Thank you all for coming to listen to my informative speech today. Today I'm going to discuss music therapy and how it's proven as an effective form of therapy. As you all know, music has long been an outlet for humans to find release from stress and express different thoughts without words. And it's been proven that music therapy can affect developmental growth even within the embryo. It can affect the growth of the womb. And in some cases, medicines have replaced natural forms of therapy and proven ineffective. Music is something very near and dear to my heart, that's why I picked this subject, because it's something that I have actually used to manage different forms of stress and just deal with different situations in my life. So it's something that when I found out there was a music therapy program that you could actually get a degree in, I was very interested to find out what was all involved in music therapy. So basically what music therapy is it's a clinical and evidence-based use of music intervention by credentialed specialists who have completed an approved program. Music therapists actually assess the emotional well-being of an individual and design programs and sessions based off of individualized needs. Music therapy has proven effective with patients of Alzheimer's disease, patients that have had crisis or trauma, patients that are in extreme pain, children with developmental delays such as Down syndrome, schizophrenia patients that have extreme depression, insomnia, and various addictions such as alcohol and drug addiction. So how does that actually work? How does music therapy work? Basically, music therapy works by stimulating your brain. Obviously, music stimulates your brain. And based on the beat of the music, the faster the beat, the more concentration that you have to have. The slower the beat, the more meditative effect that it would have on an individual. And this change in brainwave activity enables those with developmental delays to shift their brain more easily to adapt more easily on their own. Obviously, other things such as breathing and heart rate are affected by music. I'm sure you can think of, listening to your favorite song, you may get more elated, or if you listen to a classical, song, you may have a more calming effect. It may calm you down. It could lower blood pressure, ease muscle tension, and things like this. Different types of musical therapy are, there's different things. There's drum circles that a music therapist does, song singing, playing instruments. Children that can't express thoughts with words can respond with an instrument, whereas they wouldn't be able to respond otherwise. Guided imagery, so they can see something and then play the imagery to get their thought across, whereas they couldn't do that with normal words. Listening therapy, they can listen to a certain type of music and respond based off of that. And it helps promote wellness, manage stress, as I mentioned before, alleviate pain and express feeling. The first academic program for music therapy was in 1944 at Michigan State University. And just more recently, in 1998, it became an official, the American Music Association was formed and it became official. And there's over 5,000 music therapists in the state of Texas. There's actually only 4 in the area of Houston. So it's not something that there is a lot of, but it's something that's becoming more popular with research in different areas of disease and disabilities. So in conclusion, I have this quote from Oliver Sacks in the journal Brain, basically saying, all of us have had the experience of being transported by the sheer beauty of music, suddenly feeling a sense of the sublime or a great stillness within. They can still be evoked, as far as I can judge, even in deeply demented and sometimes agitated or tormented patients. Music can bring them, if only for a little while, a sense of clarity, joy, and tranquility. So while we know that music can't cure things such as diseases like cancer, or it can't bring someone out of a really diseased state, it can complement medicine, and it can help them help them progress to a state of wellness and help them through that. So that's a little bit about music therapy. Does anybody have any questions or?
Yes, I think. How can music therapy help with the Alzheimer's patients?
There is an example of an Alzheimer's patient that I can think of where the woman cannot actually talk. But for whatever reason, when her music therapist was there with her, she could sing. So it was something to where she didn't have the ability to express thoughts with just simple words, but with the singing, she could actually express thoughts. So it's something that music brought that out of her, so she was able to vocalize for the first time. So that's something that music can do. You want?
Are the music therapists required to learn an instrument?
Most music therapists are accomplished musicians in one area of music, so that whether that be piano or guitar, they don't have to be accomplished musicians, but the program that you go through does actually take you through all of the courses of music, so you have to learn all of the background, and most of them are. They do have one instrument that they play. Any other questions?
So how long is the program, like the program in music therapy? How many hours of school do you have to go through and all that?
So you do have to acquire a bachelor's program in music therapy, and then once you finish that, you do have to do 900 to 1,050 hours of an internship. So it's not just like someone off the street can become a music therapist. You actually have to go through that whole program to get certified, and then once you have that, then you can become a music therapist, get a job.
Are there any programs around here or in the state of Texas?
There is one offered at SAM. So Sam Houston is the most local school that actually has a bachelor's degree that you can actually take and get your certification. Thank you very much for listening to my speech today, and I really appreciate it. Thank you.